All right, good morning, and welcome to the Hawaii Health Data Warehouse's Coffee Break monthly webinar series. I'm Julia Chosey, and I'm a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW, and research faculty at the University of Hawaii at Manoa Office of Public Health Studies. We're going to use the next 30 minutes to introduce you to the Physical Activity and Nutrition, or PAN Plan 2030 tracker on the Hawaii Health Matters website. The presentation and demo should take about 20 minutes, and then we'll have a few minutes left for questions and a hands-on activity so that we finish up in half an hour. All right, let's get started. Today we'll be exploring the Physical Activity and Nutrition, or PAN Plan 2030 tracker on Hawaii Health Matters. The Hawaii PAN Plan 2030 is a guide to increasing physical activity and healthy eating in the state. In the long term, the plan hopes to result in reduced overweight and obesity as well as chronic disease. It is part of a larger framework, the Healthy Hawaii Strategic Plan 2030, which is led by the Chronic Disease Prevention and Health Promotion Division within the Hawaii State Department of Health. The Healthy Hawaii Strategic Plan, or HHSP, is a roadmap for preventing and reducing chronic disease in the state of Hawaii through 2030. A large and diverse group of stakeholders contributed their expertise to examine 6 different health areas: asthma, cancer, diabetes, heart disease and stroke, physical activity and nutrition, and tobacco. The HHSP guides work on health priorities to create sustainable changes where people live, learn, work, and play so that healthy options become the easiest choice. The full plan and the executive summary can be accessed at hhsp.hawaii.gov. Of the 6 topic areas in the Healthy Hawaii Strategic Plan, Hawaii Health Matters has trackers for 3: cancer, physical activity and nutrition, and tobacco. In the future, additional trackers may be created. These 3 trackers can be accessed on Hawaii Health Matters by hovering over the Track Progress tab on the HHM homepage. A drop-down menu will appear with the Healthy Hawaii Strategic Plan at the top, and if you hover your cursor on this, a further drop-down appears with the option to go to an HHSP overview page or to any of the 3 available trackers. You can also get to the trackers by clicking on the Track Progress tab, which opens a page that shows all the available trackers, including the 3 that are part of the Healthy Hawaii Strategic Plan. A little bit more information about the PAN Plan 2030. It consists of 4 different sectors: community design and access, education, healthcare, and worksite wellness. And the plan establishes data-driven objectives to transform our communities, schools, healthcare, and work sites to improve the health and well-being of the residents of Hawaii. The PAN Plan 2030 identifies 3 priority populations with the goal of targeting health disparities, which is when an outcome is seen to a greater or lesser extent between population groups. So for the PAN Plan, the priority populations include Keiki and youth, Kapuna, and low income. The PAN Plan 2030 tracker is a tool to easily monitor the state's progress toward physical activity and nutrition goals. It is located on hawaiihealthmatters.org and consists of a curated dashboard of 50 PAN measures along with target values for the year 2030. The tracker allows stakeholders and the public to monitor the state's progress toward these targets. In addition to an overarching section for broad indicators, the PAN Plan tracker consists of 8 different topic areas. For nutrition, these include breastfeeding, food security, fruits and vegetables, sugar-sweetened beverages, and other. And for physical activity, the sections include active transportation, education, and physical activity guidelines. These topic areas help organize the tracker and provide a framework to easily explore a given area. 20 new indicators were created on Hawaii Health Matters to include in the PAN Plan tracker. Here you can see some of the new indicators created from the Behavioral Risk Factor Surveillance System, or BRFIS. These indicators include measures of food security, as well as neighborhood support for physical activity that allows easy access to walking or biking. These new indicators on children's consumption of sugar-sweetened beverages and fast food are from the BRFIS Random Child Selection module. These are the new indicators from the Youth Risk Behavior Survey, or YRBIS. They involve food security, sweetened juice drinks, and sugar-sweetened beverages, and physical activity breaks during class time. Additionally, these 4 YRBIS indicators regarding transportation to school were added. These look at students who walk, wheelchair, or bike to school, and those who do not due to safety concerns in their neighborhood. Just a little overview of how Hawaii Health Matters works. Comparison data and icons use colors and symbols to interpret the point estimate. So in general, red is bad, green is good, and blue is neutral. Solid trends are statistically significant, while mostly white trends are not. And checks mean a target has been met, while X's indicate those that have not. Let's go ahead and get started. So you can get to Hawaii Health Matters from our hhdw.org page, or you can type in hawaiihealthmatters.org. But from HHDW, you can see, you can access it here on the left. And what you'll see here is our rotating banner that provides important announcements and shows our featured content, which is for this month, the new PAN Plan 2030 tracker. This rotating banner also gives information about data releases and is where you can register for coffee breaks. If you scroll down, you see this little mini dashboard. So this is our Focus On dashboard. And what it does is it pulls together indicators that are relevant to the featured content. So again, to the PAN Plan tracker. It shows a selection of indicators from the tracker just to give an idea of what kinds of information is going to be available in the tracker, and then provides a link to go directly to the tracker for more detail. Now, I showed you these on the slides, but I want to show you on the live site too, as far as getting to that Healthy Hawaii strategic plan. If you hover over track progress and then come down to Healthy Hawaii strategic plan, you can get to our overview page. And this page has information about the plan itself. It has links to the 3 different trackers that are available on Hawaii Health Matters, and then placeholders for future trackers. And on the HHSP website, there are long-term measures that address all 6 areas of health areas. And if you're interested in seeing those long-term measures, you can get there by clicking on any of these 3 titles down here. You can also download the plan itself or the executive summary from this page. So it's a great resource. And then if you're interested in going to a specific tracker, you can just go from here. If you click on the track progress page, it will show you all of the trackers that are available. And then below in a separate section, it shows you the 3 that are available for the Healthy Hawaii strategic plan. So we'll look at the physical activity and nutrition tracker. And here it is. You can see there's some introduction, some background about the plan, information about its vision and goals. And then at the bottom, there's links to the plan itself, to the executive summary, and to the implementation plan for the physical activity and nutrition plan. Below this introduction, you'll see this geography selector. So before we get into the data, if you were interested in a particular geography, you could actually select it here and the tracker would filter to data from that geography. We'll keep it at the state for now. You can also look at the data in what they call card view. So this is exactly the same information. It's just presented in a slightly different format. And we also have a colorblind mode for people with visual disabilities. So what this does is it activates these little thumbs up and thumbs down icons to let you know which way things are going. Then we get into the tracker itself. So you can see it starts with 4 kind of overarching indicators about health status and body weight. And then we move into the topic areas. So for nutrition, we have breastfeeding, food security, fruits and vegetables, sugar sweetened beverages, and other, which is a fast food indicator. And then for physical activity, we have active transportation, education, and physical activity guidelines. So those are the 50 indicators that make up the PAN Plan tracker. You'll notice that each of these indicators has a target value. These were all calculated based on baseline data. So these are the target values that we're aiming for the year 2030. So right now, since the tracker is new, all of these are going to be red X's. We're not going to have met any of them. But as time progresses, this is a great place to come and see what kind of progress we've been making, where things have been improving. And what we hope to see is a lot of these green checks like here. So let's take a closer look at one of these indicators. We'll look at adults who are obese. Below the title of the indicator is, again, another geography selection. So you can choose a specific geography if you're interested. And you can also look at older data if you're interested. The default is going to be the most recent year of data, but if you wanted to look at older data, it is there to examine. Below that is the definition of the indicator, and this is a really good thing to keep an eye on because it tells you exactly what you're measuring. So this indicator shows the percent of adults aged 18 and plus years who are obese according to the body mass index. And then it defines the body mass index and states that a BMI of greater than or equal to 30 is considered obese. So that's what we're measuring here. Below the definition is a little bit of the public health importance of measuring obesity, why we care. And then below that, we get into the data. So here we can see that in the year 2021, 25% of adults in the state of Hawaii were obese. And this is from the Behavioral Risk Factors Surveillance System. For those of you that are familiar with our HHDW.org site and your custom queries, you might like to know that this link will take you directly to HHDW to this indicator where you can customize your own query. And if that sounds intriguing to anybody who doesn't know about HHDW, just check out our YouTube channel because we've got some great tutorials. So 25%, great. Let's put some context around that value so we can really kind of understand what it means. So we are doing better than the median value for states and territories, which is 33.9%. We're about equivalent to our prior value, which was 24.5%. We're trending up and significantly so. We have met the Healthy People 2030 target of 36%, but we have not met the PAN Plan target of 22.8%. You'll notice as I hover over these icons that the window pops up to give you some additional information about each one. So this is just a helpful way to get a little more information. And then if you see an icon or if you forget what something means, this legend is always available on the left-hand side of the website. So you can always click on here and get a little refresher. Below our comparison data is our trend data. So here we can see the percentage of adults who are obese over time, and you can see it does look like it's trending up. This chart can be downloaded as a JPEG or a PDF. You can also download the underlying data in a CSV file for your own visualizations. And then there's some chart options as far as confidence intervals and axes. So that's our trend data. And below that is our subgroup data. So this is where we can see the data broken out by different demographic subgroups. And the groups that are available depend on the data source. I know for the Behavioral Risk Factors Surveillance System, we're able to look at that data by quite a few different subgroups. So you can see here, we've got several to look at. Depending on the data source, there might not be as many, but we provide what we can. And you'll see that the system actually does a little bit of statistics for you. So here, when we're looking at adults who are obese by age, we can see that that 45 to 54-year-old age group, that red bar, has a significantly higher prevalence of obesity than the state overall. And conversely, our older population, the 65 and up, has a significantly lower rate of obesity than the state overall. So this is a great place to identify health disparities. It's basically a color-coded for you. So we can see adults who are obese by age. Here is education level, employment status, percent of federal poverty level, race, ethnicity, sex, and sexual orientation. So this is a great way to develop further understanding of the measure that you're looking at and identify those groups that are experiencing disparate outcomes. Below the breakout data is this geography box. And what this will provide is a tab for every geography that is available for this indicator. So for adults who are obese, we can actually see the data all the way down to the census tract level. I'm going to look at counties first, though, because I want to show you what this looks like when you select a geography. You get a nice map and a chart and a table. And what this has done is it's ranked the 4 major counties in Hawaii. So we can see that Honolulu has the lowest prevalence of obesity and Hawaii County has the highest. And you'll notice that as I hover over one element in one of these windows, the corresponding element highlights in the other two windows. So this is a really good functionality, especially when you're looking at a lot of geographies. If you are interested in looking at a comparison value, you can easily do that here. So you can look at any of these comparison values. For example, let's say we wanted to see if any of the counties had reached the PAN Plan target value. Well, we can see that no, not yet, but we still have time. So this is where you can augment this graph with additional contextual information. I just want to show you the census tracts real quickly because it's pretty impressive to get data at this level. And you can see here what it does is it ranks all the census tracts in quintiles. So you can easily see where the high prevalence of obesity census tracts are and where the low ones are. The nice thing here too is you can actually filter this. So if you were only interested, say, in Maui County, now what you'll see are the census tracts just for Maui ranked in these quintiles. The data table is downloadable and it gives you a nice little summary at the bottom with the lowest and highest values, the median value, and the interquartile range. So that's what the geography box gives you. Below that is where you'll see information about the data source or data sources. In this case, the data are actually coming from two different sources depending on the geography. So there's a little bit of red text just to warn you in comparing across geographies. But most of the time, what you'll see is just one data source, and there'll be a link to additional information about it. Below that is where we come to our related content. So again, this is where Hawaii Health Matters gives you a little bit more context than just the data. We have a resource library that we keep populated, especially we try to really focus on local reports and local resources, so that when you're looking at an indicator, this will pull up related content for that indicator. So you can see we have other indicators, we have reports, we have fact sheets, and we have plans. And depending on the indicator, you may see websites or infographics. There's a whole host of resources that are available. So that is what our physical activity and nutrition tracker looks like. I hope that this brief overview has helped you become familiar with it. I'm going to put up a quick activity to give you the opportunity to test out finding data in the system. Let me go ahead and do that. So if you have questions, please contact us at profiles@hhdw.org. So we look forward to seeing you in February when we will be exploring the latest birth data for the state of Hawaii. And I will now review the activity. Okay, for the activity, the first question was, how is adult fruit and vegetable consumption defined? And what is the trend over time? So we can go to our fruits and vegetable section. And here we have adult fruit and vegetable consumption, which is defined as the percent of adults who eat 5 or more servings of fruits and vegetables per day. And then the question also asked about the trend. So it is trending down, which is not good. We want to see more people eating fresh fruits and vegetables. The next question, how did Hawaii compare to the US for mothers who ever breastfed, and what is the PAN Plan target? So now we can go to our breastfeeding section of the PAN Plan tracker, which is towards the top. And we're looking at mothers who ever breastfed. So the comparison, we're doing better than the US value at 94.5%, and our PAN Plan target is actually 100%. So this is a very important indicator to have breastfeeding be part of the birth experience. The next question, which county has the highest rate of teen non-diet soda or pop consumption? So for this, we will go to our sugar sweetened beverage section, and we're looking at teens who drink non-diet soda or pop at least once per day. And the question asked for the county that had the highest value. So we'll go down to the geography selection and choose counties. And now we can see that Hawaii County has the highest prevalence of teens who drink non-diet soda or pop at least once per day. And then the last question, how does the PAN Plan target compare to the Healthy People 2030 target for adults who met aerobic physical activity guidelines? I'm going to go ahead and go back to the beginning of the tracker. I know we're interested in looking at guidelines, which are towards the bottom tracker. So here we have adults who meet aerobic physical activity guidelines, and that's for the comparison. So here's an example of one where the state has already reached the Healthy People 2030 goal of 52.9%. Go us. But we have an additional goal set by the PAN plan of 62.2%. So that is the activity, and we invite you to join us next month and in March for the Burfus release. Thank you so much for your time. If you have any questions, I'm happy to stay and answer.